Dr. Childress here. In this video segment, I'm going to be talking directly to mental health professionals. Targeted parents, authentic parents, stick around to hear what I say to mental health, but you can kind of sit back and relax for this segment. In this video segment, I'm talking to you, other therapists and child custody evaluators. As you're aware by now, if you're watching this video, I've empowered targeted parents to be dangerous to ignorance by activating for them standards 2.01 and 3.04 of the APA Ethics Code. And I'm telling them to use their power to file licensing board complaints against ignorant and incompetent mental health professionals. Now, we don't want to hurt anyone. We do not want to hurt you. We really don't. But neither are you allowed to be ignorant when treating this particular pathogen. This pathogen relies on hiding behind a veil of concealment and enlisting allies of ignorance to enact the pathology and disable efforts to interfere with and prevent the pathology. Because of the unique features of this particular pathogen, you cannot be ignorant of this pathogen if you're going to assess, diagnose, or treat this special population of children and families. All we're asking is that you become knowledgeable about the nature of this particular pathogen and be competent. Read Foundations. This will describe this particular pathogen for you. This pathogen is a product of disorganized attachment networks that have coalesced into narcissistic and borderline personality traits that is distorting the family's transition from an intact family structure united by the marriage to a separated family structure united by the continuing parental roles and relationships with the children. Read Foundations. It'll explain it all. For a period of time now, working with this particular subspecialty area may become professionally dangerous, especially if you don't know what you're doing, because both the pathology of the narcissistic borderline parent and the expectation of competence by the targeted authentic parent may result in a higher than average number of licensing board complaints being filed. If you want to sit this one out and simply not practice with this special population, totally understandable, no problem. But if you're going to assess, diagnose, or treat this special population of children and families, you must be knowledgeable and you must be competent. These parents, the targeted parents, the authentic parent, they have the right to expect that. Their children's healthy development is on the line. They're just trying to protect their children from the psychopathology of a narcissistic borderline parent. That's totally understandable, and it's just what they should do. As you heard me tell the targeted authentic parents, all we want is for you to assess for the 3 definitive diagnostic indicators of attachment-based parental alienation. And if the 3 diagnostic indicators are present, to then make the appropriate DSM-5 diagnosis that's specified in Foundations. Particularly the DSM-5 diagnosis of child psychological abuse confirmed. If the 3 diagnostic indicators are present, that's the specific DSM diagnosis that the targeted authentic parent will be looking for. To protect yourself from retaliation from the narcissistic borderline parent for making the diagnosis of child psychological abuse confirmed, all you have to do is document your assessment of the 3 diagnostic indicators and the result as the justification for the diagnosis, and you can then rely on the support provided to you by Foundations. That's one of the key reasons I wrote Foundations, is to protect you. It gives you a fully elaborated theoretical foundation. It gives you 3 clear and definitive diagnostic indicators, and it gives you the appropriate DSM-5 diagnosis, including the justification for the diagnosis of child psychological abuse confirmed. When you rely on the theoretical underpinnings provided by Foundations, you'll be on rock solid ground and you'll be entirely safe from board complaints. Just conduct the assessment and document the record in the medical record the results of that assessment. There'll be more information about this on my website. And if you do the assessment for the 3 diagnostic indicators and they're not present in the child symptom display, then make whatever diagnosis is appropriate. Just document in the patient's record that you conducted the assessment for attachment-based parental alienation and that the child did not meet the 3 diagnostic indicators because, and then document what criteria weren't met. Then you'll have this full support offered by Foundations for not making the diagnosis. You conducted the assessment. The 3 diagnostic indicators aren't present. It's not that attachment-based, if the diagnostic indicators are not present, then it's not attachment-based parental alienation. As I told the parents in the earlier video segment, about 20% of the families that come to me with alleged parental alienation actually turn out not to meet the 3 diagnostic indicators. And the parent-child conflict is actually the result of some other factor. That's fine. Just conduct the assessment for the 3 diagnostic indicators and document the results in the patient record, no problem. We're not out to hurt anyone. The targeted authentic parent just wants professional competence in recognizing the pathology. That's all. Foundations is designed to protect you. It gives you a solidly elaborated theoretical foundation and clearly articulated approach for assessment and diagnosis. If you stay within the context of Foundations, you'll be fine. If you do the assessment and document the findings, you'll be 100% safe from the targeted authentic parent, because all they're asking is that you do the assessment. Well, and also that you be knowledgeable. But you'll do that, right? I mean, do a little learning about narcissistic and borderline personalities, the attachment system, delusion formation, and personality disorders. That's not an unreasonable expectation, is it? I mean, if you're going to be assessing, diagnosing, and treating narcissistic and borderline personality dynamics, distortions to the attachment system, and the decompensation of narcissistic and borderline personalities into delusional belief systems, you kind of need to know about these things. But what you're not allowed to do is to continue to be ignorant and work with this special population of children and families. This particular pathogen uses the ignorance of others to recruit allies to both enact the pathology and to prevent others from interfering with and preventing the pathology. So professional ignorance is a particularly problematic feature with this specific pathogen. So nobody's out to hurt you. We just expect you to be knowledgeable and competent in your assessment, diagnosis, and treatment of this special population of children and families. And when the diagnosis of attachment-based parental alienation is warranted, to step up and make the correct DSM diagnosis of child psychological abuse confirmed. Oh, and one more thing. When you make the diagnosis of child psychological abuse, this will seemingly engage your professional duty to protect. Now, there's probably a number of different ways you can discharge your duty to protect, such as providing a formal letter documenting your diagnosis to both parents. But whatever you do to discharge your duty to protect after making the diagnosis of child psychological abuse confirmed, or even suspected for that matter, it's probably a good idea to document in the patient record what you did to discharge your duty to protect. Me, personally, I'd recommend you file a formal suspected child abuse report with the appropriate Child Protective Service agencies. That's an absolutely clear and solid way to discharge your duty to protect. But it's up to you. Okay. You'll just have to do something and document what you did to discharge your duty to protect. So, targeted parents, follow me to the next video.